Back on Steel and Banton, you know, Linda, going into the break there, you're saying COVID, it's not over. It's certainly not over in China. It's horrifying what we're seeing happening there.
My goodness. I mean, what's happening right now is that I have seen video of bodies lined up and hearses lined up trying to get to funeral homes because China's in the midst of a massive COVID surge. In Shanghai, they think half of the residents of Shanghai, millions of people, are going to have COVID in the next week or so. Oof. And they believe that about 1 million Chinese people will die from COVID next year. So part of the problem is that they have, I believe, substandard COVID vaccines, and they don't want to accept the ones that are coming from other parts of the world, in the US and Canada. So yeah, China's...
There's the lineup. That was the lineup to the crematorium.
Yeah.
And then you see the hospitals. It's very reminiscent of those early days of 2020 when we were hearing Italy's closed.
Right.
Remember when it was like, oh, and the doctors are yelling for help and we can't, it's too much, it's too much. The global community wishes they could help the people of China. And yes, the dictatorship that doesn't want to admit that their vaccines are substandard, comparatively speaking. If only there were a way to help from here.
The other thing too is that just when we think we're almost done with COVID and the World Health Organization thought maybe 2023 would be done, and now China is exploding. So the problem is that COVID has really gone a long way to creating massive divide and polarization and toxicity and anger and death threats. And Dr. Bonnie Henry was on the show last week and we talked about that. You didn't get to see it because there was so much to talk to her about.
Hours.
That we thought we were going to pull that chunk, talking about the hate that she has faced around her COVID policies. And we thought you should see just a taste of it. We're going to play it for you next week on the show, but this is just a taste.
Just a taste.
What surprised me was it started very early on, and the level of vitriol and the types of things that people would say, and that they felt it was okay to give me very specific death threats, and I know you've experienced some of that, and it sticks with you. And you know, I talk about hate, and my office was, the people around me were affected by this, and that is so hard to see how they get attacked just for being associated with me. And so that's been the hardest part about this, has been that level of a shocking level of vitriol and hate.
We'll have the rest of the interview with Bonnie Henry next week on the show, as you mentioned, Linda. And one of the things that shocked me is when she said that death threat, that vitriol, that hate started on the very first health briefing in January of 2020, before the pandemic was even declared. It's just unbelievable. And she references the fact that I was copied in on one of her death threats, and that's all part of a criminal situation that I'll update you on in the new year as well. But it's vitriol that you both you and I have dealt with.
It's not okay. And you can say, Dr. Bonnie Henry, maybe she got some things wrong. This was a moving target, and they were learning as we were going along. And yeah, some health officials, maybe if they had a do-over, might have done things a little bit differently, but they have been working their tails off for 3 years. So tone it down. It is not okay to be hurling that kind of abuse at anyone, frankly, whether it's your next door neighbor or the provincial health officer.
Yeah, exactly. And what was beautiful last week, also something that you didn't get to see because we had so much going on in the show, was when Jann Arden walked in and Dr. Henry's face changed because she didn't expect to see a national treasure walk in. And Jann launched into this.
On behalf of the hundreds of thousands of people that don't have the opportunity to stand in this close proximity. And thank you for towing the line, for being completely vulnerable, for being strong, for being steadfast, for staying on the messaging, for constantly trying to protect people that sometimes don't want to be protected. It's nothing short of inspiring, and absolutely, for me as a woman of a similar age, I know what it's like on social media to be facing that kind of vitriol constantly. I don't mind doing it because I'll do it on the behalf of the people that really are on the right side of history.
Yes, girl.
And that I firmly believe that your messaging has saved hundreds of thousands and millions of lives, that the reason that we're all walking around right now and enjoying doing this show and being down here around other people is because of those of us who were vaccinated, who took the chance and have faced a lot of scrutiny. It is us that broke that chain. The people that got vaccinated and took the time to be immunized, to do that with your children, to be safe, to mask, whatever we had to do early days. That's why we're walking around. It wasn't some magical fairy dust that like, oh, it was nothing. No, it's science. We're walking around because that chain of events was broken. The efficacy of the viral loads that people started getting after their second, third, fourth booster. I get my fifth booster next week before I go to the UK.
Yes.
And I thank you on behalf of all of us. It's amazing to see you do this work. It's not easy being a public person, and especially when it's very divisive. So you kick ass, and I'm grateful for the sacrifice that you've made also this last few years. Your family, your friendships, your social life, things that you've had to face and endure. Thank you.
Here, Jann Arden. So many people DM'd us, just said, say that to Dr. Henry, and there's Jann doing it without us even needing to say it.
Yep. It's awesome. Listen, we've got some more kind of tough stuff coming up on the show. Thousands of people dead from drug overdoses, thousands more still living rough on the streets. Our next guest is an addiction specialist who says the government's wasting billions of our tax dollars.